Welcome to the 236th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I speak with Erica Lee and Madalena Marinari about their project, Immigrants in COVID America. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live, Twitch, and Periscope. And you can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please help spread the word and send suggestions for future guests and future topics. As of today, March 9th, 2021, there are 2,607,837 deaths from COVID-19 globally. That's according to the Johns Hopkins University Coronavirus Resource Center. In the United States, the present death toll from COVID-19 is 527,389. And in Brazil, the death toll is 268,370. A way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way, and I'd like to continue that now. The headline is, America's Immigration System is a COVID Superspreader. This was written by Eli M. Kahan and was published February 26, 2021 in Scientific American. In her teens, Leticia Sierra realized that the future she had envisioned was out of reach. Sierra, who lived in San Diego, fled her native Mexico after suffering multiple episodes of sexual abuse before her kindergarten year. But since Sierra was an undocumented immigrant, she was not eligible for military service, which she'd need to afford nursing school. I was blocked from pursuing my dreams, she says. 2 decades later, Sierra's future was inverted once again. After being pulled over because her then boyfriend was on the phone while driving, and after being searched without a warrant, the police found several tablets of Vicodin in Sierra's purse. A friend had given them to her for back pain. Within hours, Sierra was turned over to Immigration and Customs Enforcement, known as ICE, and deported to Tijuana. Desperate to come home and be with my 2-year-old son again, she said, Sierra found her way back to San Diego. There, she, like many undocumented immigrants, lived a quiet life 1 block off Main Street, cleaning homes with her mother and paying her taxes for over a decade. Things changed again on January 16th of 2020. That morning, after dropping her son off at the bus stop, Sierra found a dozen ICE officers waiting outside her home, undercover cruisers still running arrest warrant in hand. After she changed out of her pajamas, family watching, the officers cuffed her on the hood of one of the SUVs. Before she knew it, Sierra had been deposited at ICE's Otay Mesa Detention Center to await her immigration proceedings. And there she was, waiting when COVID-19 hit. During the COVID-19 pandemic, detention centers have ranked among the most dangerous settings in which to live and work. Since March of 2020, ICE facilities have experienced some of the worst outbreaks of the virus. As of February 24th of this year, 2021, when this article was written, some 9,569 detainees in total had tested positive for COVID-19. About 10% of those tested have had the virus, a figure which was 17% higher than the general U.S. population. In the time since ICE began testing its detainees, a detainee has died of the virus nearly every month. This amount of suffering did not have to happen. These statistics, as they stand today, were not an inevitability. Rather, since March, at the federal level, ICE has enacted policies inconsistent with Centers for Disease Control and Prevention guidelines. While conducting arrests and raids that run afoul of public health recommendations, and at the facility level, ICE subcontractors have treated detainees with cruelty and callous disregard while simultaneously evading local health departments' recommendations and offers for help. First step ICE could have taken was to release detainees, especially those with medical conditions, making them vulnerable to the virus. Indeed, early modeling studies predicted that even amongst the most optimistic assumptions, without widespread release of those under custody, detention centers would be a setup for disaster. However, as of late February, ICE had released only about 3,500 detainees vulnerable to the virus. Meanwhile, tens of thousands remain in government custody. In lieu of reducing detainee populations, ICE and its subcontracted operators could have constructed physical safeguards and instituted hygienic protocols within facilities to reduce the spread of the virus. Much as inherent challenges to containment of infectious diseases exist in crowded detention centers, as they do in other carceral settings like jails and prisons, and congregant facilities like nursing homes and rehabilitation centers. Theoretically, these settings are amongst the most amenable to strict precautionary procedures. Yet clear inaction by ICE and its for-profit subcontractors has allowed the virus to run rampant. Since the outset, physicians have noted inconsistencies in ICE infection management policies that significantly differ from those set forth by the Centers for Disease Control and Prevention, the CDC. These include policies for intake monitoring, grouped quarantine, and social distancing that failed to meet CDC guidance. The result, placing further stress on a system teetering on the verge of disaster and putting detainee lives at risk. After an officer at Otay Mesa contracted COVID-19 in March, staff began wearing protective equipment. This is in 2020, but detainees didn't receive masks for weeks, and those who ripped sleeves off t-shirts as stand-ins for the real thing were put in solitary for vandalism. In April, in order to receive masks, detainees were required to sign a waiver saying it wasn't our fault if we got sick, Sierra said, while they were verbally accosted with ethnic slurs. By the May of last year, detainees were getting sick left and right. Sierra herself developed a fever, headache, severe fatigue, and blisters on her mouth and legs, but were denied tests since they did not meet criteria for COVID-19, Sierra said. Detainees with psychiatric symptoms, including a peer who seemed to be hallucinating, were put in 4-point restraints. On May 6, 2020, Carlos Ernesto Escobar Mejia, a detainee living in the dorm next to Sierra, died of COVID-19. They treated us like less than animals, Sierra said. Every night, I worried that I wouldn't wake up. As all of this was happening, emails obtained by immigrant defense advocates and the American Friends Service Committee indicate that officials on the other side of the bars were rejecting, ignoring, and avoiding San Diego Public Health Services recommendations, the SDPHS, San Diego Public Health Services. That's the acronym that they use. Internal guidelines addressing PPE use established on April 1st did not require masks for staff or detainees in most circumstances, allowing officer discretion based on their scope of duties and as feasible. On May 19th, SDPHS guidance strongly urging facilities to test staff were rebuffed. Just so we're clear, at this point, we have no intention to mass test our staff, Assistant Warden Joseph Romish replied to a request. It took until September 21st for the facility to discuss its COVID containment plan with SDPHS. It took until September 23rd for the facility to collaborate on testing. Decisions like this at Otay Mesa and many other facilities do not only put the health of staff and detainees like Sierra and Mejia in danger. Experts say that since detained individuals and staff exposed to the virus act as disease vectors outside the facility, outbreaks in detention centers can be catastrophic for neighboring communities by rapidly overwhelming ICU capacity. California State Senator Scott Wiener has labeled ICE a known super spreader of COVID-19. On July 17, 2020, Sierra was released. While she's left Otay Mesa, it hasn't left her. She continues to have flashbacks, nightmares, and insomnia, and she hasn't left the immigration system either. She's in asylum proceedings, and her court date got pushed back from November 4th of last year to April 24th of this year. Her son is afraid whenever I leave the house that I won't come back, she said. If I had to go back, I don't think I'd make it out. Okay, let me introduce my guests for today. This is a conversation I've been greatly looking forward to. Let me introduce you to them. Erica Lee is a Regents Professor of History at the Asian American Studies and in Asian American Studies and Director of the Immigration History Research Center at the University of Minnesota. Recently elected to the American Academy of Arts and Sciences, she's the Vice President of the Organization of American Historians and author of 4 award-winning books, including most recently, The Making of Asian America, A History, and America for Americans, A History of Xenophobia in the United States. America for Americans won an American Book Award and the Asian Pacific American Book Award for Literature, Asian Pacific American Award for Literature. It was also highlighted by the Washington Post, the New York Times, and the New York Public Library as one of the most important books illuminating the Trump era and informing essential issues in the 2020 election. Madalena Marinari is Associate Professor of History at Gustavus Adolphus College. She's written extensively on immigration, restriction, U.S. immigration policy, and immigrant mobilization. Her book, Unwanted, Italian and Jewish Mobilization Against Restrictive Immigration Laws, 1882 to 1965, came out in 2020, and this book explores Italian and Jewish mobilization against immigration laws from 1882 to 1965. She's a co-editor with Maria Cristina Garcia and Madalena Su, and she's one of the editors of A Nation of Immigrants Reconsidered, U.S. Society in an Age of Reconstruction, 1924 to 1965, which is an anthology on the impact of immigration restriction in the U.S. in the 20th century. She is co-editor with Erica Lee of a forthcoming special issue of the Journal of American History on the 100th anniversary of the passage of the Emergency Quota Act of 1921 and the Immigration Act of 1924. Madalena Marinari and Erica Lee, thank you so much for your time today and joining me on COVID Calls.
Thank you for having us.
Thank you.
I'd like to start the way I usually do, just to find out where you're calling from and what the pandemic situation is looking like there. Erica, may I start with you on that, please?
Yeah, I'm calling from Minneapolis, and we just got notification today. The governor put out his vaccination update that I guess we've reached 70% of all 65-year-olds and older who have been vaccinated. So now they're moving on to the next stage. So not sure when a vaccination is in my future, but we're getting a bit closer, and I'm seeing people out and about. I think there's definitely a light at the end of the tunnel for some.
That's some good news. Madalena, let me bring you in. Same question, where you're calling from and your take on the pandemic situation.
I'm coming from Minnesota as well, but unlike Eric, I was in a big city. I live in a very small town in rural Minnesota, and precisely because of that, although no one has quite explained why, rural areas seem to be doing better in Minnesota, especially in terms of vaccinations. I am hopefully eagerly waiting for my turn, which according to the map that we received today, it's probably not going to be until the summer, but I'm glad that everyone else is getting a vaccine.
Madalena, just to follow up a little bit, what's been the situation on your campus then? Have you been able to go back to campus, or students were there throughout, sheltering in place?
So we have been on camp, except for the first 2 weeks of each semester, we've actually been on campus. I teach hybrid. Most of us teach either hybrid or online. And so I see my students at least once a week. At least so far, everyone seems to have be well behaving. We actually don't have a very high caseload, so hopefully it stays that way for the next 2 months, and then summer break is here.
Erica, I just wanted to get an update from you on campus life there, particularly in big cities. It's been very hard for universities, I think, to manage the flow of students in and the impact that might have on neighboring communities. How has it been going there?
So it's interesting because we get messages from the administration, and there's a lot of plans, there's a lot of protocols, there's a lot of information. I have been teaching remotely all year, and so that's been going well. But then when I do talk to undergraduate students and ask them, they'll say that I know more people who have had COVID than those who have not. And so there's a gap. There's a gap in, I think, the official numbers of infections and cases, and then the reality of college students who are just trying to make it through the school year. And part of that does include socialization and probably not following the protocols like the university expects them to.
Well, you're both busy scholars ordinarily, and then COVID has, you've been extraordinarily productive in this time with a new project together. I'd like to start by asking you just a little bit about your prior work, your work before the pandemic year started. And Madalena, let me ask you first, because I'm particularly interested to see how you see that work now in light of the pandemic.
So I think, I guess I'm glad that I did a lot of research before the pandemic hit. But for Erica and me, I think I distinctly remember having this conversation in the fall of 2016 when the election had happened and we all sat around the table worrying that immigration might be coming to the forefront. And so we actually put together an immigration syllabus. We crowdsourced it so that it would be open source for everyone. But we've also been writing and speaking about this issue. And I think it's out of that long-standing concern that we came up with this project, because we saw both the kind of rhetoric that was preceding about immigrants, it was preceding the pandemic, but also some of the policies that were being implemented. In terms of my research, I think I've learned to pay even more attention to policymakers, but also try to identify the real consequences of these policies on regular people, but also how immigrant groups try to respond. And so in a way, I'm even more motivated to highlight these experiences since COVID.
Erica, let me ask you the same question. You've published so many important books in this area, and I am curious, if you want to say a little bit about the sort of enduring challenges you see in that scholarship, unanswered questions, but then also sort of bring it into the stream of the pandemic for us a little bit. I'm always fascinated to talk to scholars who've worked on a theme for a long time, and then somehow the pandemic brings a new lens.
Yeah, absolutely. So Madalena and I are both historians. And for us, that means study of the past, but that is not enough. We are interested in how the past informs contemporary debates and understandings. And so we are part of a new generation of scholars who are really responsive, like Madalena suggested or talked about. We were responding to the 2016 elections and the projected, and then it came true, massive changes in immigration. And similarly with the pandemic, Madalena and I knew, that the emerging research was already showing that Black, Indigenous, immigrant, refugee, other people of color communities were already being disproportionately impacted by higher risk to infection and then infection and mortality. And so, we wanted to capture this moment in real time, to capture and document history in real time in order to facilitate research, to facilitate equity responses to the pandemic, and hopefully just create a larger public resource for others. In terms of my own research, I had just finished a book on the long history of xenophobia in the United States. It ended with the full Trump administration, and then the pandemic hit. And even before infections had been reported in the United States, there were already these horribly racist tropes and sensationalist social media messages coming from across the globe about the Chinese virus and how Chinese people and Asians were particularly super spreaders or sources of contagion. And I had a pit in my stomach thinking, that it was just really going to be a matter of time until we saw the impact here in the United States. Unfortunately, it's been much worse than I could have predicted. We're looking at over 3,000 anti-Asian hate incidents in the past year with no signs of this letting up. So this has absolutely impacted my research, but also it's directly impacted the community from which I'm from.
I just want to follow up on that, and both to what Madalena said and what you're saying, Erica. Is immigration history and the history of migrants, is that an area that tends to also make this demand of scholars to move into a more, you haven't used the word activist, but a more active stance as a scholar? Because I think when people tend to think about the historical profession, particularly as it's been practiced in the United States, they think of it as a relatively conservative discipline compared to maybe even other humanities and social science disciplines. I'm curious your sort of sense of the field, or is this been a turning point since 2016? It's become a more activist space for scholars. Erica, let me ask you that first, and then Madalena, bring you in.
I think scholars of migration have always been at the forefront of advocacy work and been involved in public conversations and policy debates. The generation of scholars ahead of us were certainly part of those political discussions. But as the field of immigration history, which was founded mostly around the study of European immigrants, as that has expanded to include Asian Americans, Black Americans, Latinx peoples, it has taken on more of an ethnic studies perspective, which does include activist roots. And so I think that's part of the trend in the scholarship, but I do think that something did change in 2016, where I think it wasn't just immigration historians, it was climate scientists, it was feminists, it was so many different groups and scholarly communities that wanted to combat disinformation and to play more of an advocacy role. But immigration historians, I think I'm proud, to have been part of this movement.
Madalena, let me just bring you in on that same question around sort of the temperament of that of the discipline and the subfield, because I think your reaction, and we're going to turn here in a second to talking about your project you're working on together, Immigrants and COVID America. That to me seems like the kind of thing I wish we had in every subfield in history coming into the pandemic. That we're having to build these things in real time seems to me incredibly difficult, incredibly necessary.
I wanted to follow up on what Erica said, but yes, I think we felt, in part because immigration had been so front and center in the previous 4 years, I think it would have been neglectful, irresponsible of us not to do anything and not to try to capture these experiences as they were unfolding, especially because I remember Erica and I having this call in April, fearing that things might actually get really bad. And unfortunately, we were right at so many levels. But I do think that in part because the larger field of immigration history has moved on, really tracing the history of racialization, mass incarceration of immigration restriction. It's almost inevitable that if you study those historical trends, you almost feel an ethical obligation to try to make a difference right now. And so I think a lot of us have participated in amicus briefs, for example. We have talked to anyone who wants to listen, trying to give a historical perspective. But also, I think the other piece of this that was really important for us was to humanize this issue, because around immigrants, refugees, and asylum seekers, because the last 4 years have really dehumanized these populations. Sorry, go ahead, Erica.
No, I wanted to make sure you were finishing.
I'm done. Go ahead.
I'm sorry. I just wanted to add one more important piece of context. Both of us are calling from Minnesota. And of course, over the summer, we are the match that lit the fire around a global reckoning over race and racial disparity, racial justice, racial equity. And I think that for us, many of the emerging projects like the Atlantic's COVID racial data tracker, or Harvard University did a great guide on Black America and COVID-19. These were some of the projects that helped inspire us to do the same. So I think there's just many different sources, sources of inspiration for us. But I did want to, make sure to mark that, for us here in Minneapolis and Minnesota, the police trial of, Derek Chauvin and the George Floyd murder is happening right now. And this has certainly been a factor in the way in which we have developed this project, but also how we approach these issues of equity during the pandemic.
Just a reminder that you're listening to COVID Calls, and I'm talking with Madalena Marinari and Erica Lee about immigration history. And we're going to start talking now about this project they've been working on. Madalena, let me turn to you first. The project is called Immigrants in COVID America, and you have a number of different sort of tracks within the project, and I'd like to talk about each of them. One of them is around workers, and I wonder if you could tell me a little bit about that. Maybe let me back up one step and just sort of ask you about sort of the scope of the project. What kinds of things does it do? And then focus in a little bit on this labor and worker issue. I think the term essential worker is one that we're going to be grappling with for a long time. It has an inheritance of work that has often been deemed second class, is inherently dangerous. Now it's been termed essential, but there's a lot of politics around whether or not essential has meant safe. So that's a lot to hand you, but I'm interested about the project and also this particular theme, Madalena.
Yeah, so last spring, as I mentioned, Erica and I were having a conversation, and we were seeing trends that were troublesome, but also we worried about leaving a record for posterity, but also creating a starting place for researchers, activists, artists, anyone interested in this topic to draw information from. And so we actually had long conversations about which issues to focus on. And so we chose these four, which is immigration policy, the economy, health, anti-Asian xenophobia, and then eventually we actually added, and it's not on the website yet, vaccine and equity. And that's been a really interesting development, especially in terms not just of access, but disinformation among some of the communities that we're interested in tracking. And so we expected that the immigration section would be extensive, but tracking how many little changes the Trump administration carried out in the name of COVID was both interesting and demoralizing, because essentially the immigration policy brought any kind of immigration in the United States to a halt, because there was not an aspect of immigration that was not affected by it. And so that's when, if you follow the story, you realize that the pandemic became an excuse to carry out an agenda that had been there all along, and they gave an opportunity essentially to do that. And I think undoing the damage, I know there is a lot about that in the media right now, undoing the damage that has been done in the last few years, but especially over the last year, is going to take a long time, especially because it has created certain ideas about what immigrants, refugees, and asylees should do, should expect, the kind of rights they're entitled to. And so really we wanted a depository, a collection, a curated collection of different kinds of sources, multimedia, but also a short description so that people can access and use the information for whatever purposes it serves them, right? When it came to labor in particular, things became really interesting, in part because of the terminology surrounding them, right? These essential workers hailed as heroes at the beginning of the pandemic, and of course that phase has ended. But even though the rhetoric never quite matched the practice, right? Because oftentimes these people had a choice between going to work and catching COVID because they were not offered adequate protection, or losing their job, right? And that's really not a fair option for them. But we know now that these people have been at the forefront, not just of keeping our lives going, our economy going, but also at the forefront of the number of infections that for example, in Minnesota, some of the workers in meat factories have had really high rates of infection, not just at the personal level, but also in their families and their communities. And so I think the kind of documentation that we've done around workers really shows the tension and almost the hypocrisy between hailing these people for making a huge sacrifice so that we can stay home and be safe, and really our inability to provide for them, right? Now that in some of the states, for example, that have lifted the mask mandate, just in Texas the other day, a Mexican restaurant became the target of a very negative media campaign, and because they wanted to enforce the mask mandate, and people threatened, they call ISOM them, right? So,
Madalena, let me just follow up on one part of that, because there's a convergence here, which I think is I'd like you to help explain if you can. As you said, I think it's a powerful idea that there were already immigration restrictions and plans for further restriction throughout the Trump administration and before, but certainly in the Trump administration, that the pandemic provided an excuse, a cover to go further. But then bringing in the layer of labor, it seems to me that's a compounding force, because then the work site also becomes to apply restriction, pain, to make it harder for people who are in the country, many of whom legally, to make it harder for them to stay, or to want to stay, or to want to encourage others and their families to come. It's an added layer of restriction, which I think that layer has gone unnoticed or unanalyzed. I wonder if you could speak to it.
No, definitely. And I wanted to mention something, well, two things to just give an illustration. Part of the issue that sometimes gets lost in this conversation is that some immigrant communities are overly represented in certain jobs, right? And so, for example, one of the stories that we've captured is that in the Filipino American community, where a lot of women are nurses, they have an incredibly high death rate, right? And it's because it's not about just about closing the opportunities, but also the long-term impact on this community, because immigrants are often relegated to specific jobs. I think in terms of policies, this is the first time in 100 years that I can think of where the administration actually believed that families should not be together, should not be allowed to reunite, right? And the pandemic really gave them an opportunity to carry that forward, not just for immigrants, but both legally and illegally in the country. But there is also, I guess, a little piece of good news. There was also the discussion around becoming a public charge. So using any kind of help, whether that's food stamps or Medicaid, which the Trump administration wanted to argue that would disqualify you from applying for naturalization and then citizenship, which was that would have had a devastating consequences. And it seems that the Biden administration is going to finally drop that. But I think that's just two examples of how the intersection of xenophobia, the pandemic, and labor has really wreaked havoc on these communities, both in terms of their livelihoods, but literally staying alive and being able to reunite with their families.
Let's talk about the track of xenophobia and violence here. Erica, you're the author of America for Americans, A History of Xenophobia in the United States, which, as I pointed out earlier, has been flagged as a book essential to understanding the Trump era. Usually when historians' work is flagged as essential for understanding a time period, it's to say, oh, that's great. It's good to understand this time. That was almost a warning, though, it seemed like. People needed this book to understand what was unfolding before their eyes. And as was mentioned from the very beginning, Trump racialized the pandemic. And then rather than letting it drop, that became a big part of his electoral strategy. I wonder if you could take us, again, you said you felt a pit in your stomach when this started to unfold. Talk to us a little bit about that book in light of the year.
Yes, right. How to make a really depressing topic even more depressing.
Even worse. Yeah.
Right.
That's kind of my job on this podcast. So thank you for helping.
That's right. Right. There's a couple of trends. One is the long-standing history of connecting immigrants with disease, whether it be Italians or Jews or even Germans in the 18th century. But there is a really deep and enduring history connecting and racializing Chinese people in particular as sources of contagion. They're a great example, not great. There are very telling examples in our history, including the 1900 bubonic plague outbreak in San Francisco, where Chinatown was essentially quarantined. So that's the long history. And it continues through the HIV/AIDS crisis, through SARS, through MERS. But the pit in the stomach, was stemming from not only this historical knowledge, but also the very current understanding of our former president and his very successful use of xenophobia, talking about how the wall will keep out the virus, talking about how we need to, stop immigration to keep out the virus. So, what happened again, even before infection rates rose in the United States, was a global anti-Chinese sentiment that is deeply rooted in many countries' histories, but that really caught fire in two ways. One is with President Trump and many conservative lawmakers' consistent and unabashed use of the terms China virus, Wuhan virus, Kung flu, very strategically to inflame, to deflect attention at the federal government's mismanagement of the pandemic. And then also the role of social media. Researchers have been able to track that every time the president used one of those terms, it would get retweeted 800% more. And so this was in those early months, this was the dominant way in which Americans came to understand the virus as a foreign thing, as something from China, and as something that was China's fault. He doubled down on that message during the election, and in that way, continued to use that same divisive political rhetoric, the demonization, the incitement to violence that we then saw on January 6th for Asian American communities, not just Chinese, but for Asian and Pacific American communities. The result has been disastrous. The number and very well reported number of hate incidents has been nothing like we've seen before. 1,800%, then a rise than the year before. In some places like New York City, a 2,600% increase. So this really is a crisis point. And there are many tragic aspects to this, but one is the further tragedy that this places on, say, Asian American Pacific Islander healthcare workers who are already, placing their lives at risk. They're at the front lines. They're disproportionately impacted and part of our public health response, who then face anti-Asian discrimination as they're going to work or leaving work. And then the other aspect is how xenophobia generally has made it much more difficult for contact tracers to trace the chain of infection amongst immigrant and refugee communities who are fearful of what the government is going to do with that information. And now we're seeing reluctance to get vaccinated. So, you know, one of the things I always like to point out is that xenophobia is not just something that targets immigrants and refugees. It actually impacts and hurts all of us. And there's, you know, no better way of seeing this than in a pandemic when we need to contact trace and now we need to vaccinate everybody. This is just a real shame, and it didn't have to be this way. It just multiplied the disruption and the cost of lives of the pandemic even more than it had to. It's I think just a real tragedy.
I want to underline that connection you're making there, and thank you for making it. And I'm learning from you in the way you're articulating it, which is that if you just try to put xenophobia in a box and say this is one phenomena of the pandemic year, you're going to miss a much broader phenomena which has real health impacts. One of my concerns is that those health impacts, and this probably comes back to your project, are very poorly documented. So we have these sort of aggregate statistics, and we have, you know, maybe as this year goes on, we'll get better statistical accounting from the agencies we usually turn to trust in that regard. But these kind of things you're talking about, impact on Asian American and Pacific Islander health worker communities, fear that people might have just going to the supermarket or going to the street or going to the health clinic, those are health impacts which are embedded within this culture of hate and violence. I don't know how you untangle that. It's more of a statement than a question, but I'm wondering how you approach that, or what your sort of how this project can be an intervention in that regard, because I think we need it.
I mean, I think you put it very very well. You know, we've realized the pandemic has made us understand that we are more connected to each other, that our well-being is more dependent on each other than we ever could have imagined. When you don't wear your mask, that puts me at risk. When you're not vaccinated, that puts me at risk. And if there's some other socio-political force that is hindering you from going to the health clinic, from getting vaccinated, that puts me at risk. So, you know, if it takes an appeal to our selfish desire to stay healthy, just ourselves, if that's what it takes to combat xenophobia, then you know, I'm all for it. You know, anything that can break down some of these barriers and walls, but then hopefully have a longer lasting impact, you know, after the pandemic gets more contained is what the goal should be.
Erica, just one more follow-up in what you're saying, and then Madalena, I want to come to you and find out a little bit more about some of the stories that have been generated in this project. But I don't like to give Trump too much credit, but I have a causality question for you, Erica, because, you know, I think back to September 11 and the wave of anti-Muslim hatred that swept across the United States with real violence, not just words. And I think you could go back and look, and if you read Bush closely, you can find some catalytic language, but nothing in the order of what Trump has done. So there was already that impulse at that time that emerged even without a president fanning the flames. Now we come to 2020, and Trump is, as you say, he's not only just fanning it, he's leading it. So how strong is the effect of a president? How do you sort of solve for the Trump, solve for T in this regard? You know, how important are the words of a president, a single person, in this sort of causality of xenophobia? I ask you this because I'm puzzling over this myself and trying to figure out how much of that pandemic year is Trump, or how much of it is always there, sort of hidden in plain sight for immigrant communities, obscured for non-immigrant communities, and then it emerges.
It's both, and one cannot work without the other. So to be clear, it hasn't just been name calling. That's what's happening to Asian Americans. There have been physical attacks. There have been murders. So it's not just people being sensitive to being, targeted with derogatory phrases. Xenophobia is always there. That was the lesson of my deep dive into history. And it's not just one president. It's not just a president. It is this president who was able to rally, a deeply loyal and deeply impassioned, passionate response, who did not respond well to facts, to be honest, to complexities. They were very much, that acted very much like a lynch mob, and so with that power to activate such a passionate response came the danger. So Bush did try to placate the emerging anti-Muslim sentiment. His words mattered. That was a very important response. The government, his administration, did something very different. Did start to survey and arrest and deport South Asian and Muslim and Arab Americans.
Right.
We can't let him off the hook. But Trump is both a continuation of a trend, but an extreme version of this political passion and activation that has had really poor consequences for many communities.
There's a lesson there from a great historian about multi-causality. Madalena, let me bring you in on this.
I was gonna say that at the same time, it also shows the fragility of our democracy, right? That one person could tap into these deep-seated strands of xenophobia that have over a century's history, right? I think one big lesson that I often think about, what do I want people to take away from this project? And perhaps my biggest hope is that we can't move past COVID, January 6th, the racial tensions of this past year without really admitting that we have a problem, right? And without recognizing the history behind this racial injustice, behind the unequal treatment, and quite frankly, the willingness to ignore how this virus is devastating some communities more than others, right? We can't just, once we're all vaccinated and we're gonna come back to normal, whatever normal means, we can't just say, okay, let's move on. These things are all interconnected, and they're gonna repeat themselves if we don't acknowledge that they didn't come out of nowhere, right? My students always like to say history repeats itself. It's like, that's not true. It builds on itself. We got here for very specific reasons because things happen in the past. And if we keep ignoring that, we are bound to repeat these mistakes.
Madalena, let me just stay with that for a second, because I share your concern that, and it's a bind that we find ourselves in, that the vaccine is going to save lives. We want that, obviously, but I'm very worried, and the United States has a terrible history of this, that as a disaster reaches some point of closure, usually when it falls off the front page of the newspaper, it's not commanding as much media attention. There's a desire to not only sort of push the history aside, but rewrite the history or unwrite the history, so that these kinds of concerns we're talking about in this conversation don't become as important as we look back, as they look to us now. And I wonder again, I mean, your project, Immigrants in COVID America, is an intervention in that space, but what else could be necessary? I mean, I'm thinking about K through 12 curricula here, other kinds of spaces, which are also part of democracy, democratic action, where we won't let go of this moment. I agree with you, a reckoning is necessary, but I'm not sure what form it takes, and I'm worried that time is slipping away.
Well, I'm going to be selfish. Bring back the humanities, especially history, right? I mean, part of the problem, I don't mean to be obvious, but killing the study of humanities, defunding them, is a problem, right? Because studying history is not just about learning facts and names and dates. It's about gaining critical skills and analytical thinking, and quite frankly, questioning authority, right? And not trusting what anyone tells, even the president of the United States, right? And kind of saying, okay, what are the motives here? Why is this rhetoric, anti-immigrant rhetoric, being used right now? What is it that we're not being told? How is it being deployed? I think education is definitely a centerpiece of this. I also think that while the virus might wane, there are long-term consequences and unintended consequences that we cannot even predict. I mean, in general, I'm thinking about what has done to women in the labor force. And we also, I mean, I'd be interesting to see, I lived this pandemic through two worlds, right? The Italian, my family back home, and the United States, where Italy has childcare, the United States has women, right? I mean, if this doesn't create some momentum to create some childcare and help for families, I don't know honestly what will. And I think the communities that Erica and I have been tracking are even more victims of this inequality in terms of childcare, healthcare, access. And so while I think that there is going to be the sentiment of moving on and leaving this behind us, as historians, we just cannot let that happen. And I hope, right, that institutions of higher education, K through 12, will work towards that.
Seems like one of the most powerful tools historians have is collecting and mobilizing first-person narratives. And I know that's a feature of your product. Erica or Madalena, either of you want to talk to it first? This part of the project around stories from the pandemic I thought was quite interesting. I wonder if you might tell us a little bit about this part of the project.
Yeah, I'll start. This is a partnership between the Immigration History Research Center and the Sahan Journal. Sahan Journal is a nonprofit digital news organization based in the Twin Cities that has a sole mission around reporting on immigrants and refugees. They are a really phenomenal resource, and we've been so pleased to be able to partner with them and highlight some of these stories from the pandemic. I hope that listeners and viewers will go especially to this section of our site, because there's some just phenomenal first-person stories. And I'd love to just highlight one story, which is the story of Minneapolis teacher Mariam Muhammad. She talks about how it has been such a struggle to be a teacher, during this time period, but also how her particular refugee background as a refugee from Somalia has provided extra insight into both the additional hardships of her students, but also the ways in which this has impacted the entire family. So she talks about how when she was growing up, she was often the one who was the translator for her parents, helping her parents study for their citizenship tests. So she was doing the homeschooling, for her own parents. And when she is online with her students now, she is seeing how her, young students are struggling on their own, how the elder siblings are taking the role of the parents and helping with the homework, because the parents are essential workers and are not at home to do that work. And so she sees this in both the inequality, of the situation for her students, but also it reminds her of how, for immigrant and refugee students, the whole educational process in the United States has been one of inequality even before the pandemic. She's doing her part. She also has written two children's books to help shine a light on the Somali refugee experience. And so this is just one of the stories that we're highlighting to examine the impact, the really varied impact of the pandemic on immigrants and refugees.
Madalena, did you want to contribute one or reflect a little bit on the sort of power of these first-person narratives in the project?
I think that's going to be crucial. That was always part of idea. It's like we want to track the coverage, but we also want to bring stories. Personally, I plan on using immigrant stories, a template that professors can use in their classes in every single class I will teach, to document immigrant stories through the pandemic. I think this is the only way not to forget, but also to keep these experiences alive and create a record for future researchers as well.
So we're almost up on time, and I want to just give you each a chance. We've covered a lot of ground here, and I can't wait to dive more into this project myself and use it with students. Anything else you wanted to highlight? How long do you see, what's the time horizon of this project? I assume it goes beyond COVID. There's so many of these interesting, sort of important archiving in the moment projects, and they've got COVID in the title, but I can't help but wonder, they're going to have to go beyond COVID, because COVID is a disaster with no clear end in sight. Erica, how are you thinking about the next phase of the work?
The project as it exists online right now covers the first 6 months of the pandemic. In the next couple of months, we're going to update it so that we're covering the first full year. And then beyond that, Scott, I'm just not sure. I'm not sure whether we've got the capacity to keep on going, but you're absolutely right. This is, I remember, we all remember in December of 2020, when we were all saying, oh, we can't wait until 2021 when things get back to normal. Right. And, that was naive, obviously. And so, now, as I said in the intro, there's a light at the end of the tunnel where there's a lot of positive news about vaccination. But as we've talked about today, some of these major seismic shifts in our economy, our society, our politics, and of course our public health are just going to have repercussions for a really long time, and we won't fully be able to understand the impact for some time. But we hope that the work that we've done documenting in real time the impact on immigrants and refugees will be a first step in helping all of us understand the long-lasting legacies.
Madalena, the last word to you, and come back to a little bit full circle where we started, that as historians become active in interpreting the now, while I also do the other work of interpreting the past, it's doubled your workload, but it's crucial. Your sort of final thoughts about this project as it goes forward?
Yeah, so like Erica, I'm not quite sure what the future holds for us, but I know that we're both committed to seeing it through and continue advocating and not letting kind of like we're going to be writing about this. Even the short issue of the Journal of American History will have an epilogue that will include some of this and some of the findings. And that's a way for us to bring attention to historians now and in the future that this is a resource. But I also, my biggest hope is that we continue contributing personal stories because those are often the ones that get lost or purged from the record. So if nothing else, that is something that I'm committing myself to doing in the copious amounts of time I have, of course. But
absolutely.
Thank you.
Just a reminder, you've been listening to COVID Calls, and you can catch COVID Calls live every weekday at 5 p.m. Eastern Time. And a programming note, we will be having more COVID Calls also at 5 p.m. Korea time coming up in the weeks to come. Tomorrow, 5 p.m. Eastern Time, I'll be talking with historian Chris White and his project, the COVID in Appalachia podcast. So please do join me for that. And I just want to thank my guests today, Madalena Marinari and Erica Lee, for this really insightful hour. Thanks for all the work you're doing, and we really appreciate your time today.
Thank you
Thank you so much.
Thank
Stay healthy, everybody. See you tomorrow, 5 o'clock.